Madam President, I ask consent that the following statement I'm about to make be placed at a separate part in the record.
Without objection.
Thank you, Madam President. Madam President, no state, no community in America has been spared from the coronavirus pandemic. Nationwide, we've lost nearly 570,000 mothers, fathers, grandparents, neighbors, friends. In Illinois, the number is 21,000. Like so many other diseases and health conditions, the pandemic has inflicted disproportionate harm on communities of color, Black Americans, Native Americans, and members of the Latinx community. Sadly, these disparities come as no surprise. America has a long history of medical inequality. From premature births to premature death, people of color suffer disproportionately in America's troubled health system. People of color in America suffer more chronic and acute health conditions. They're likely to go without needed medical care, shorter life expectancies. The reason for the disparities are many, but they include access to affordable health care, inadequate research, and too few health care professionals. Martin Luther King Jr. called health care inequality, quote, the most shocking and inhumane form of injustice. Far too often this inequality begins even before birth. It should shock the conscience of America, one of the wealthiest nations on earth, that we have one of the poorest records on the globe for the maternal health. Think of this. The United States is one of only 13 nations in the world where the maternal mortality rate, the death of mothers, is worse now than it was 25 years ago. How is that possible? Every year in America, nearly 1,000 women die from pregnancy-related complications. 70,000 others suffer near-fatal complications as a result of pregnancy. And now, think of this. Women of color in the United States are 3 times more likely than white women to die as a result of pregnancy. In Illinois, sadly, that number is 6 times more likely. What makes these maternal deaths even more tragic is that an estimated 60%, more than half of them, are preventable. I've given much thought to this and spoken with real experts, which is why Robin Kelly, the Congresswoman from Illinois, and I joined with Senator Duckworth and a number of other Democratic senators introducing legislation to decrease America's rates of maternal sickness and death, especially among new mothers of color. We called our measure the Mama Act. One of the major provisions of this legislation is a requirement that Medicaid provide health coverage for new moms for a full post-pregnancy period instead of just 60 days, which it currently is. Congressman Kelly and I worked hard to get a modified version of this provision in the American Rescue Plan, President Biden's singular achievement in the first few weeks in office. And thanks to that law, states now have the option to expand their Medicaid program for new mothers for the next 5 years. Making sure new moms have health coverage for a full year post-pregnancy will go a long way toward catching, preventing, and treating potentially life-threatening conditions and problems. This is critical because in some states, even my state of Illinois, nearly 60% of pregnancy-associated deaths occur between 43 and 364 days postpartum. Well, there's good news to report today. While we're still working to pass the Mama Act, the state of Illinois pursued another avenue for expanding Medicaid coverage for new moms. For over a year, Illinois has been seeking a Medicaid Section 1115 waiver to allow Medicaid-eligible women in our state to keep their health coverage for a year after their pregnancy. Representatives Kelly, Underwood, Senator Duckworth, and I have been leading letters and championing this effort for our state. And this week, I am happy to announce the Biden-Harris administration granted that waiver, making Illinois the very first state in the nation to extend postpartum Medicaid coverage for new moms. This will ensure access to vital health services and help to promote better birth outcomes and reduce the rate of maternal sickness and death in my home state, and I hope set the stage and model for other states to follow. I can think of no better way to honor this year's Black Maternal Health Week than to support state efforts to expand Medicaid health care to new moms. Another way would be to pass Senator Booker's 2021 Black Maternal Health Week resolution, which I'm proud to co-sponsor. As the poet Maya Angelou told us, we can't change the past, but when we know better, we must do better. We now know that we can do better to protect the lives of pregnant women and newborn babies, and I'm pleased that my state of Illinois will be part of leading in that effort.